Hi guys, Jane here. Sorry I didn't make any videos last week, and sorry for not letting you guys know. I was just drowning in work last week, and I just did not find the time to write the scripts, shoot the video, and to do all that jazz. So I apologize for not uploading a video, but today we are going to continue on with the What Is It series, specifically the mood disorders. So today we're going to be talking about MDD. What is MDD? Disclaimer, I am not a mental health professional. Therefore, please do not use this video as a diagnostic tool. Rather, it is just an educational video that is used to inform the general public about what MDD is. Now, if you're looking at this video and you're just like, oof, this sounds a lot like me, please go seek a mental health professional so that you can get diagnosed and get the proper treatment. If you still want to confirm the validity of my research, please go down in the links down below and check out all the resources that I've used. And given that I'm not a mental health professional, please feel free to leave any comments, experiences, additional information, or even corrections down below so that we can make this platform more educational. Given a large amount of information about each video, I cannot possibly give you guys all the information, especially about MDD. So, if you guys want to learn more about it, please click on the links down below and see all the resources that I've used, or feel free to research yourself. So what is MDD? MDD stands for Major Depressive Disorder. It is most commonly known as clinical depression or depression. Many people don't call it MDD, they just say depression, but that is the formal name, at least in the DSM-5. So basically, major depressive disorder is a mood disorder that is characterized by a persistent feeling of sadness. Now, what are the signs and symptoms of major depressive disorder, and how does one even get diagnosed with it? Well, according to the DSM-5, the symptoms must last for at least 2 weeks. 5 or more of the following symptoms must be present in a depressive episode. Number 1, feeling sad or having a depressed mood. This is one of the hallmark features of depression. Now, since this symptom is very self-explanatory, I'm not going to explain this one because that symptom itself gives away the meaning, because you just feel sad when you're in a depressive episode. Number 2, loss of interest in the activities and interests that were once fun. So this is a very, very typical symptom for depression, and many people, they don't want to do the hobbies, interests, and pleasure-seeking activities that they once liked. For example, if someone really likes to knit, and that has been their hobby, they're depressed, they might not even feel like knitting anymore. They just don't have the energy, they don't even feel like it. Number 3, changes in appetite. So it can go of one or two ways. Some people can overeat and they can binge on things, grabbing out that tub of ice cream. And other people they just don't eat at all. And that's the reason why it also leads to weight changes as well, because some people can gain weight and some people can lose weight. None of these weight changes and eating habits are due to dieting purposes. It is mainly due to the eating habits that the depression is bringing. Number 4, changes in sleep. So this can also go one of two ways. You can either sleep a lot and oversleep, and for example, you can sleep for like 15 hours, and then other people, they experience insomnia, where they just cannot sleep at all and they're staying up. 5, loss of energy and fatigue. When someone is depressed, they feel like all energy has been just sucked out of them, and they almost feel like a carcass, like they just cannot get themselves to do anything. Such simple things too, like brushing one's teeth. Like that is even difficult for a person with depression. Number 6 is increase in purposeless activities or slowed movements and speech. So basically, people with depression can have a very slowed speech and movement. Like even when they're eating, they might raise their spoon very slowly, or when they're speaking, they might speak really slowly and it feels like there's a lot of weight in their words. They might also do purposeless activities such as looking at the ceiling for hours and hours, or pacing around the room for hours and hours, or just doing nothing. Which leads me to the seventh symptom, which is difficulty thinking, concentrating, or making decisions. Now, during this time, a person is not only physically unproductive, but they're also cognitively unproductive. No matter how hard they try to concentrate on their homework or their work or anything, they just can't do it. Whether it's making decisions or thinking about things, it's just too much work for them. And they just can't bring themselves to concentrate or focus on the task at hand. Number 8, they feel worthless and guilty. A lot of people with depression can feel guilty and they might feel like they're worthless because of themselves, their character, what they have done, what they didn't do, what they're not like, what they are like. Like, there's so many different reasons why a person with depression might feel worthless or guilty about themselves. The 9th symptom is thoughts of suicide or death. This symptom is by far the most serious symptom of this disorder because this symptom has the potency of taking one's life away. Death is permanent, and so if the person finds themselves ending their own life or even thinking about ending their own life, they should get prompt treatment at that point, because that means that the depression really has progressed far enough to the point where they feel like living is not worth it anymore. Now, what are the risk factors of depression? Now, one of them is biochemistry. So studies have shown that there are chemical imbalances that can induce depression, particularly the serotonin levels. They see a lot of decreased levels of serotonin in depressed patients. Number 2 is genetics. So depression can definitely run in families. So if one has a relative, parent, sibling, or any other distant relatives that have depression, they're more susceptible in getting them. Number 3 is personality. So people who naturally have a lower baseline, or they might have lower self-esteem, or they get easily overwhelmed with stress, or they're more generally pessimistic than others, those people might be more susceptible in developing depression later in their lives. Number 4 is environmental factors. Now, continuous exposure to violence, neglect, trauma, abuse, all of those negative things can lead someone to develop depression later in their lives. Now, what are some psychotherapy treatments for depression? One is called CBT, which stands for Cognitive Behavioral Therapy. Now, a lot of the mood disorders have CBT as their psychotherapy, and the reason why is because it uses mindful techniques and uses the cognition of the patient in order to change their thinking, which would therefore change their actions. Other psychotherapy treatments can include IPT, which is interpersonal therapy. So basically, during that time, they can learn ways to deal their emotions and problems with others, and how to improve their relationships with anyone, whether it's private or professional or whatever. They try to give them skills in order to socialize with others in a more healthy way. Now, many people don't really bring this up, but when the treatments haven't worked at all, some people with depression opt for ECT, which is electroconvulsive therapy. Now, basically what this is that they hook the person up to a machine where it induces seizures to provide relief for mental disorders such as depression. Now, what are some medications that people with depression can take? The most common type of medication is antidepressants. And so there are various kinds of antidepressants, so I'm going to explain them here. But before I do so, I want to tell you guys that not all people opt in for the antidepressants. Some people can take other alternatives, such as mood stabilizers, omega-3 fatty acid pills, or even St. John's worts, like, the more natural alternatives, or they might even change their diet and exercise. However, antidepressants are the most common, and I'm going to tell you 3 kinds of antidepressants. Number 1 is called SSRI. It stands for Selectively Serotonin Reuptake Inhibitor. So basically what this does is that in the neurons, there is a sending neuron and there's a receiving neuron, okay? Now, I don't know how to do this, but imagine there's a sending neuron here and there's a receiving neuron here. Now, the thing is, the studies have shown that there are decreased levels of serotonin within the space that's between those 2 neurons. So basically what SSRIs do is that they prevent the serotonin neurotransmitters to get sucked up back into the sending neuron. If they get sucked back in, then there's not enough serotonin between those 2 neurons. So what the SSRIs do is that it prevents the reuptake, the reabsorption of the neurotransmitters, so that there are more neurotransmitters between the 2 neurons. Now, that region between is called the synaptic cleft, if you are wondering. Examples of SSRIs are your basic Prozac, Paxil, Lexapro, Zoloft, Celexa. Another one is SNRI, and this is selectively norepinephrine reuptake inhibitors. Now, this does the same exact thing, it has the same exact mechanism of SSRI. However, it does that with norepinephrine neurotransmitters. Examples of medications that are SNRIs are Effexor and Cymbalta. Now, there are also the third type, which is atypical antidepressants. Now, this is an NDRI. This is basically norepinephrine dopamine reuptake inhibitors. So basically, they do the exact same thing as SSRIs and SNRIs. They both prevent the reuptake, except for this one, it prevents the reuptake of norepinephrine and dopamine. I know I established before that depression is correlated with low levels of serotonin, but some people do show improvement of having more norepinephrine and dopamine in neurotransmitters between that synaptic cleft. Because dopamine and norepinephrine, it's kind of a very energizing neurotransmitters. They help you feel energized, they help you with your mood, they also help with pleasure too, especially dopamine. So atypical antidepressants are basically using other neurotransmitters to kind of fight that depression. Now, what are the statistics of depression? Now, the thing is, I forgot to establish this for all my What Is It videos, but these statistics are just statistics. Therefore, please do not think that correlation implies causation. None of the studies that I've seen and all the resources that I have, none of them say that they cause this, or this causes depression, or these cause depression. It's all just statistics. I'm just saying these statistics so that you guys can kind of have a more concrete idea of what depression is like and how many people are affected by it. Number 1. Depression is the leading cause of disability in the United States for ages 15 to 44. Wow. Second, MDD affects more than 16.1 million American adults, about 6.7% of the U.S. population, with people that are 18 years or older in a given year. Yikes. Number 3. While major depressive disorder can develop at any age, the median age of onset is 32.5 years old. What are my final thoughts of depression? I just want to clear the misconception that depression is grief. Because depression is not grief, and it's not just sadness. Yes, people do fall into grief and fall into sadness when there is a very traumatic event that has happened. All the sadness and grief that one feels after a traumatic event is called situational depression, and that is not an illness. It's a normal reaction to those adverse events. Depression should be promptly treated because lack of treatment can possibly lead to suicidal thoughts and even suicidal attempts. Now, this goes with any illness. You want to find out whether you have cancer quickly because once it's stage 4, it's really hard to treat and it's really hard to cure. That goes the same for depression, at least the concept. The more someone does not get treated or they don't really find out soon enough, they might reach the point where they feel like ending their own lives and thinking that living is worthless. And so before someone reaches that point and that stage where they feel like they want to die, prompt treatment can really prevent suicidal ideation and suicide attempts. Depression is not a character defect. Many people with depression might feel like they are worthless and they are inherently bad because of this, and that is so not true. Personally, I have been diagnosed with depression, and there are many times where I feel very worthless and I feel like this is all my fault. It's just ingrained in my personality and it's my fault for feeling this way. But I've learned this one thing. Even though I still have depression, I realized that depression is not me and I am not depression. I have learned to distinguish the two apart because depression is part of me, but depression is not me. My name is not depression, my name is Jane. I just want to let you guys know that for the people who are suffering from depression that are watching this right now, you guys can do this. If I can do it and if I'm still living and if I'm still trying, you guys can too. So please don't beat yourselves up for it because it's really the depression that's causing it. It's not your actual character that is doing that. So give yourself a hug and be nice to yourself. Thank you for watching this video. I make videos every Monday, so if you guys want to subscribe, please hit the subscribe button below and click on that bell icon, and I will see you guys next time. Bye guys.